Okay. And we do record this webinar so that if you do want to go back and watch it, we have access to it, and we usually post them on our website or other places online for other people to view. So just FYI. So let's go ahead and get started. Okay, so essentially we are introducing to our practice this new treatment called PRX T-33. It's branded by the company as WiQo. That's the brand and the name of the company, but the treatment itself is PRX T-33. I'll tell you why it's called that strange name in a moment. And that's what we're going to be referring to throughout the presentation. Before we get into it, just to introduce myself, for those of you that I have not had the opportunity to meet, I am Stephanie Schlageter. I'm the founder and CEO of Radiance. And we founded Radiance here in Bel Air Bluffs 2006, so 15 years ago. So we're currently celebrating our 15th anniversary. Just a few pieces of information about the business before we get into the subject of the day. We are a licensed medical facility. Some people don't realize that. They're not quite clear on what a med spa is, so I like to clarify that. We were founded, as I said, in 2006, and we're celebrating our 15th year in business. Our staff consists of experienced, trained medical professionals. Our specialty is non-surgical, aesthetic, or cosmetic procedures. And our mission is to help you look your best, make you feel great inside and out, which is a really fun mission to have, by the way. So we contribute to the industry 15 years of aesthetic experience. We are among the top 5% of all cool sculpting providers in the United States. We like to let people know that we are the #1 Botox facility in all of the county, as well as the #1 Juvederm facility in the entire state of Florida. So there is no single facility that does more Botox in Pinellas County or more Juvederm in the state of Florida than Radiance Medspa in Bel Air Bluffs, meaning we do a lot of those things. And I hope this doesn't sound like bragging, rather it helps you build trust and confidence in coming to our facility to get these treatments done, because we have a ton of experience. We are or have been listed on Inc. 5000's list of America's fastest growing companies 3 years in a row, and we were named the Clearwater Regional Chamber of Business of the Year. So just a few little accolades we like to share. This is just a quick slide to summarize our services for those of you who are not familiar with all the services that we offer. We're going to talk about facial treatments, which is listed at the bottom, and specifically this PRX T33 today. But other treatments that we offer are Botox and Juvederm, as I just stated. We have several treatments for skin tightening, including Vivace radiofrequency microneedling, as well as the plasma pen. We have a number of lasers for resurfacing the skin, or for removing brown spots or improving discoloration, by the name of Cool Peel, IPL, and CO2. We do a lot of body contouring at Radiance in the form of laser liposuction and cool sculpting. We do PRP hair injections, or I should say PRP injections in the scalp for regrowing hair for people who have lost or thinning hair. And we sell a huge variety of medical grade skincare products. And if you haven't been to our facility lately, next time you come, you will see that we have completed a very significant expansion of our space into the space next door. And we have quite an enlarged retail area now with a huge variety of all the latest top medical grade skincare products. So come check that out if you haven't already. And then last but not least, we have a whole host of facial treatments, such as traditional chemical peels, dermaplaning, hydrofacials, diamond glow, which we are launching next month in September, therapeutic facials, extractions, and now the new WiQo PRX T-33. So very excited to be adding this treatment to our extensive list of facial treatments. This is a slide on just chemical peels to give you an idea of how popular chemical peels are in the world and in the United States. Chemical peels are currently the third most commonly performed non-invasive procedure, both worldwide and in the United States. There were more than 1 million peels performed in the United States last year. Our team at Radiance has performed more than 10,000 peels and facial treatments since we've been in business over 15 years. Our staff has advanced certifications in chemical peeling, and we have over 15 years of experience with a wide range of chemical peels. We're not going to get too much into all the many chemical peels today, just a little. We're going to touch on it a little bit and mainly focus on this new treatment. But chemical peels come in many shapes and sizes, and we've done them all, it seems, over 15 years. So we've got a lot of experience there. And as I said earlier, we are an industry leader in aesthetic treatments, both regionally and nationally, which I hope gives you comfort and a sense of safety when coming to us for something like a peel. So I'm getting into the heart of the matter today. What is a chemical peel? I thought I'd take a couple slides to just educate a little bit, starting with some skin basics. So the two outermost layers of the skin that we talk about a lot in the aesthetic industry are the epidermis and the dermis. The epidermis is really a protective layer that protects the inner layers of the skin and the body from toxins and irritants that come from the environment around us. And the dermis is the next layer down, where really the bulk of the action happens in our skin. It's where fat and molecules exist that really determine the plumpness of your skin. But more importantly, relative to this discussion today, it's where the collagen and elastin in our skin is produced. And that is a real important determinant of skin elasticity and firmness. So essentially, the dermis determines the skin's overall quality and appearance. And for that reason, most skincare products and a lot of treatments aim to improve the health of the dermis. But it just so happens that a lot of both products and services are not as effective as we need them to be in penetrating that deep. So a lot of skincare products will treat the dermis and barely get into the dermis, which makes the epidermis look better temporarily, but doesn't really elicit significant change in the dermis. So in come chemical peels. So chemical peels are topical agents. Usually they're solutions derived from natural sources like fruits and plants and trees. Some common names are AHA, which is alpha hydroxy acid, BAHA, beta hydroxy acid, sometimes referred to as a Jessner's peel, a TCA peel, which we're going to talk more about today, and even phenol peels. There are lots of others too, like kojic acid and salicylic acid. And I mean, there just are so many types of peels. These are some of the most common listed here. And those peels are beneficial in the sense that most peels have a molecular size and an action that enables them to get all the way down into the dermis to some degree. So really strong peels will get deeply into the dermis. Less strong peels might just barely get into the dermis, but you get the idea. And most peels also, when they get down to the dermis, they necessarily damage the epidermis to get there, and they remove the dead cells on the surface on the epidermis in order to get down to the dermis, which is what creates the visible peeling. So it makes the dead surface cells on the epidermis come off in the process of delivering the product down into the dermis. So chemical peels are called peels because in almost all cases, they create this epidermal peeling as part of a side effect of the process. It's not really the goal of the peel to peel. The goal of the peel is to get down into the dermis, but a side effect is peeling. So peels generally are used to help improve the skin quality overall. So things like fine lines, like ruddy, uneven texture, pores, redness. They're really great for evening things out and just improving the overall glowing quality of the skin. We have so many other treatments at Radiance for like treating deeper lines and wrinkles, removing lots and lots of brown spots. But think of peels, chemical peels in this whole category of things as just improving the overall health and quality of the skin. Because of that epidermal peeling, it is really important that after getting a traditional chemical peel, you stay out of the sun because your epidermis has now peeled off. And until the body regains its protective layers, you're very, very vulnerable and susceptible to sunburns and sun damage. And you really have to be careful to stay out of the sun, which can be challenging in Florida. So that is one of the significant downsides of getting chemical peels, at least where we live. And most peels require a series over time, which is still true of the treatment we're going to talk about today. More specifically, I wanted to talk about what a TCA peel is, because the PRX T33 is a form of TCA peel. So we're going to kind of work into this. TCA stands for trichloroacetic acid. That is a form of acetic acid, which is found in vinegar. In fact, when you get this peel, you might even notice that it smells like vinegar. And TCA is a primary ingredient in many chemical peels. They were first used, TCA peels were first used on the skin as early as the late 1800s in Europe. So we owe it to the Europeans to deliver us all these fabulous skincare products and treatments, and TCA is just another one on the list. They come in many strengths, in fact, even higher than listed here. You can not often, but sometimes even find TCA peels in like 50% strength, but most commonly, you see them anywhere from like 13, 15, 20, 22 in that range, and upwards of 30. They're powerful and effective agents for doing the job, meaning getting into the dermis, getting deep into the dermis, and really stimulating a robust fibroblast response. The fibroblasts are the cells in the dermis that stimulate the production of new collagen and elastin. So TCA is a really effective way to stimulate that whole process and deliver a lot of new collagen and elastin to the individual. In the process of a regular TCA peel, though, it pretty much obliterates the epidermis to get through. And so you have pretty significant peeling alongside this treatment. So it's been pretty hard for people to go through TCA peels in the summertime. You have to be super careful to avoid sun for weeks afterwards. It can just be high maintenance and a little bit tricky to live through. And with the downtime that comes with your average TCA peel, especially when you get into the higher percentages, a lot of people are just not able to do those with work, with their social lives. So the downtime associated with these types of peels can be tricky. Thus, the new treatment. Before we go on, these are just some images of typical types of peeling that people might see after a chemical peel. The one on the left, pretty standard. That kind of peeling could go on for like a week after a treatment. It's not horrible. It's not like, you know, terribly discolored or anything, but you'll have these large chunks of skin coming off. And it's definitely not something you'd want to probably go to like a social event looking like. So it can be a little bit of something to plan around, and no matter how much moisturizer you put on these flakes, they're not stopping for like a week. So that's a pretty good example of like a mid-grade chemical peel. This one too, maybe even a little stronger. You can just see her entire epidermal layer is peeling off here. This one I put on here as an example of that's not really a great outcome. These are not our patients, by the way. They're just really great examples of post-peel peeling. But I picked this one because it shows you when patients aren't compliant and go out in the sun, or sometimes they go and use products they shouldn't be using on their skin post-peel, it can cause less than desirable side effects to happen, like this excessive browning of the skin, or the peeling comes off too soon, almost like picking a scab too early, and you get this really red, raw, exposed skin, which can sometimes scab, which is not, or sometimes scar. So these are just the challenges and pitfalls, potential pitfalls of getting traditional peels. I do want to say traditional peels are awesome. We do a lot of traditional peels, so I do not mean any of this to suggest that chemical peels are bad or scary, but they do need to be done with care and with careful consideration by the patient, that you understand the downtime and the flaking and peeling that you are going to have, and that you understand the importance of post-procedure compliance, like staying out of the sun. So we are now going to talk about this brand new exciting treatment called PRX T33. So it is not a peel, which is a really interesting thing because it's a TCA facial treatment, which never before has there been anything called TCA that's a topical product on the skin that wouldn't make you peel. So it's very interesting and very exciting that we can now refer to this as not a chemical peel. The company in Europe that makes it calls it a bio revitalization treatment. That's just way too big of a mouthful, but we are just calling it not a chemical peel at the moment to educate. The PRX T-33 name comes from these two derivatives. So PRX is just a shortened word for peroxide. PRX is in the word peroxide. And T33 refers to the fact that it's a TCA peel and it's a 33% strength, which is a very strong TCA. The key to this product is that they figured out how to encapsulate the TCA molecules in hydrogen peroxide to deliver the TCA through the epidermis into the dermis without damaging or breaking down the epidermis, which is pretty amazing. So that's what happens. This delivery gets the 33% TCA solution into the dermis and it leaves the epidermis intact, which means you don't get the peeling, the flaking, the sun sensitization, and you can treat any skin type because FYI, a lot of the peels that are really challenging to the epidermis cannot be done on certain skin types for fear of melasma or hyperpigmentation or secondary effects that are undesired. With this peel, because it really leaves the epidermis unharmed, it can really be performed on any skin type. So yet another bonus. This was invented by an Italian dermatologist with over 30 years of experience with TCA peels, and he figured out how to achieve that encapsulation and get the TCA through the epidermis into the dermis. So it's pretty amazing technology. Benefits of getting a peel are, think skin quality. Like if you want your skin to just look dewier, fresher, more radiant, vibrant, that's pretty much a good summary description of what this peel does. It makes your skin look more plump, more hydrated, improves pores. It will smooth the texture of your skin. If you have rough skin, crepey skin, it will even out the skin tone, lighten brown spots, and even reduce redness. So it's a great treatment for rosacea. It's a great treatment for generalized sun damage. So many benefits of this treatment. Done in 4 easy steps. The first step is cleansing the skin. This is all done by our medical estheticians. The next step is to apply the PRX, and I'll show you a video of it being done to me in just a moment. That's the next slide. Just so you can see the manner by which it's applied. Then there are a couple of topical products that are used to follow up, and we send you home with them. And there's a very specific protocol that you follow at home. It's super easy, just AM, PM application of these products. But this product is a restorative product that has some shea butter and other nutritious elements for your skin that really, really help the skin heal appropriately and rapidly during treatments. And the next one, which is referred to here as the complete and maintain step. This is actually an 8% glycolic smoothing fluid that you use daily between treatments as well. And that really helps exfoliate, but not with peeling. It just helps exfoliate the epidermis just to eliminate dead skin cells. So that is the treatment in 4 easy steps. Treatments, steps 1 and 2 are done at the time of treatment at Radiance. And then we apply number 3 before you leave, and then we send you home with the products to finish the treatment at home. So let me show you a video of myself. This happens to be me. I had the, I'm in the middle of getting a series of these done, as a matter of fact, and I cannot describe to you how excited I am about this treatment from my own personal experience, but also from all the experiences by our staff and all of the patients that we've treated so far. The reason I find it to be so exciting and seems to be the consistent feedback we get from everybody is this treatment produces immediate changes to your skin that are so beautiful. It makes your skin immediately hydrated and plumped and tighter and smoother. And it happens literally immediately and remains. And then you don't have to go through the peeling and the downtime that you would normally have to go through with a peel. So it's kind of like the best of both worlds. We do them in a series of 4. So I've had 3 of my 4. And some people just keep on going. You can do as many of these treatments as you want in perpetuity, literally till the end of time. You will just keep stimulating more and more collagen and elastin. So let me point out a couple of which, by the way, is probably going to be my plan. I would love to keep doing these forever, just because I love the effects these treatments so far have had on my skin. So let me point out a few things. You can clearly see I have some serious texture issues. Yes, I had a lot of fun in the sun when I was younger. Didn't learn until probably I was in my 30s how bad that was. And I'm still working on correcting that, but lots of great treatments and services available to help me with that. And this has been one of them. So these lines in my cheek, which are kind of like increased when I smile, they are a good target for a PRX T33 peel. We also treat the neck with the face. And so these texture issues on my neck are also a great target for this treatment. And Linda, our esthetician, is doing this particular treatment. This is not a needle, because some people I know don't love needles. This is a blunt-ended little cannula tip on a syringe, which you'll see in a minute just allows her to drip the product on the skin. And then I'll talk you through the rest of it as she goes. So this is a very sped up video. So she's moving really fast, and you can see I'm talking really fast. It takes about 30 minutes to perform the application of this treatment. There's a lot of massage, and it's not as fast as this. It actually feels wonderful. It's a really deep, hard pressure massage. They actually train providers when training on this treatment to press down with 4 pounds of force. I mean, they make them press on a scale and learn the pressure that is required, because that pressure is really what helps that TCA hydrogen peroxide molecule get pressed through the epidermis and deliver it deep into the dermis. So Linda is literally massaging and pressing the solution through my epidermis and getting it down into the dermis, which I could have sat there all day and had that massage. It was wonderful. So, and you can see she's really working on my cheek. They work on regions at a time, and they really, really work it in there and then move on to the next area. So you get the idea. We don't have to watch a whole lot more of the treatment, but I just wanted you to see generally how it goes. And we'll move on. So in summary, the process is always done in series of 4. The cumulative effects of delivering that concentration of TCA into the dermis once a week for 4 weeks is what delivers the desired end result of the treatment. It's almost like getting one big treatment out of the 4 treatments done over a week at a time. So that's the protocol that they have developed. It works really well. They're done 1 week apart. The appointment takes about an hour. Your skin looks amazing afterwards. I'll show you some pictures here in a second. As I said a minute ago, you can do as many treatments as you want to. A lot of people just keep doing series of 4 and just keep on getting better and better. Their skin just keeps on improving. The post-care is critically important. It's not just an option. It's included with the series of 4, and it includes the 8% glycolic fluid and the WiQo moisturizer that they've developed. And we include an appropriate cleanser to use during the series, as well as a really good sunblock with the right type of sun protection to protect your skin while you're healing. Now, remember, this is not a photosensitive treatment. So it's not like other peels and other treatments where you really have to strictly stay out of the sun, but sun protection is always recommended. If you're going to spend money and time trying to improve the quality of your skin, you should definitely be using sun protection every day. It's just best for the health of your skin, and it really allows your skin to heal itself when you're not continually damaging your skin in the sun. But there really are no serious sun precautions at all with this treatment, which is just amazing. So a few pre and post treatment tips. We just like everybody considering treatments at Radiance to be extremely well informed and prepared. So other things to make note in case you're getting excited about this treatment already. You do have to discontinue any other medical grade skincare products for 1 to 2 weeks prior to treatment. Depending on what products you use, we can tell you when you need to stop, whether it's 1 or 2 weeks prior. We can't treat over sunburned, irritated, or open wounded skin. So those are considerations to make. Pre-treating with antivirals is usually recommended for people who are prone to cold sores. Anytime you do a stimulating treatment around the mouth, people who are prone to cold sores can get a cold sore. So we just try to prevent that from happening. we don't want you to get any other treatments to that same area treated with the WiQo treatment for 2 to 4 weeks after the last treatment. So if you have concerns about that, we can work out a treatment plan for you. Some treatments like Botox and Juvederm are fine, and we can always walk through coordinating that with you if that's of interest. We don't want you putting makeup on the skin for the rest of the day. You can keep your eye makeup on because we don't really do anything to the eyes. We just don't want you putting face makeup on, like foundation or concealer or things like that. And we really want you to minimize use on the makeup until the next day, or as long as you can, really. Just keep the skin open and breathing, really good for healing. You can always use sunblock and put clean makeup on if you want to, but do expect immediate and impressive results immediately, like right off the bat, plus continuous improvement for weeks to months after the treatment. That stimulation of collagen and elastin takes place for quite some time after the last treatment is done. This is just a quick slide on the post-procedure skincare. We include 4 full-sized products with your package of 4, which is a really huge addition to a package of these treatments. 2 IS clinical products and 2 products that come from the company that makes the treatment itself, the WiQo products. And we just give you a simple protocol to follow AM and PM. You do this every single day in between your weekly treatments for a month. And these products are an ample supply to get you through the whole course of treatments. So are you a candidate? If you experience or are bothered by any of these concerns listed here, you are probably a good candidate. Dull complexion, dry, crepey texture, large pores, fine lines, generalized sun damage, uneven skin tone or blotchiness, brown spots, redness, just overall skin quality, as I said before, and any skin type. So basically anybody looking for fresh, vibrant skin without downtime, anybody looking for a low maintenance treatment with no photosensitivity. And it's also really good for quick and dramatic results. Like if you're doing something and you only have a little bit of time before an event, it's a great, there aren't a lot of treatments like this that you can do that before, because you'd have to make sure you plan for downtime. This picture right here, I thought represented a really great candidate for a treatment like this. It was provided to us by the company, but she resembles a lot of the things listed here. And she actually got a series of treatments, and I'll show you her after picture in a moment. This patient as well just has kind of some visible large pores, generalized discoloration, sun damage, even a little bit of texture issues up close. So she too got the treatment, and I'll show you her after pictures in a minute. So if you're still not sure now or after the end of the webinar, I just want to remind everybody, or tell those of you that may not know, that we offer complimentary consultations anytime and all the time. We love answering people's questions, providing guidance. These are very education-based consultations. We help identify or understand your skin concerns and goals, review your medical history to make sure you're medically a candidate. There's really not much in the way of contraindications with this PRX T33 peel, except pregnancy, breastfeeding, and sensitivity to the ingredients that are in the product. But other than that, it's pretty much for all skin types, and very little reason you can't get one done. And basically in these consults, we just develop a treatment plan, review pre and post treatment instructions, and talk about pricing. So if any of those things are question marks for you, please feel free to come in for a complimentary consultation anytime. And here are a few slides showing some results. I really love this picture because I can tell you this is exactly how the skin looks after the treatment. It is amazing. And it actually persists for quite some time. It's a superficial immediate response to the treatment, and it remains on the surface like this, while at the same time the dermal activity ramps up and you start getting all this new collagen and elastin. So it's a really interesting product because many peels actually do make your skin look like this, but it usually ends quickly about day 2 when you start peeling, and you don't get to enjoy the hydrated, plump, smooth, tight effect of the treatment itself. In this case, you don't have the breakdown of the epidermis, and you get to enjoy it from day one on. So it's really wonderful. I got to tell you, I mean, everybody that I've talked to, including my own experience, everybody is so in love with this treatment because their skin just looks amazing right afterwards. This patient, I put 8 treatments recommended here on this slide just to remind me to mention that if we were doing a consultation for a patient with these concerns on the top, if this was the before, we would probably, just for realistic expectations, because we really, really want people to have realistic expectations, we would probably say you should probably plan on doing 2 series of 4 to get really nice long-term results. Just an FYI for all of you. And this patient, whose before picture I showed a minute ago, she got 4 treatments and saw some really amazing results. So she could still benefit clearly from another series of 4. It's a personal choice. Like I said, you can keep doing these treatments as long as you want to, but just goes to show you what significant improvements in firmness, tightness, texture. Her skin tone looks a little more even. You know, it's definitely very noticeable in just 4 treatments. And then this gal also showed her picture earlier. She got 4 treatments, and you can just see that her complexion overall, it evened out the tone, the ruddiness, her pores are smaller, texture. It's just a really nice change in overall quality and radiance of her skin. Just looks more youthful. So packages and pricing of this wonderful treatment. Listed here first is the regular price of a series of 4. So normally a series of 4 is $1457.87. That's such a weird number because there's 4 full-sized retail products in there, the skincare, post-care, and it has tax on it. So it comes to a strange number. But our treatments always include the face and neck, and they always include, every time you buy a series of 4, you get the full 4 full-size post-care products, which have a value of upwards of $300 or something, by the way. It's a very significant inclusion in the package. Our introductory pricing, which we launched recently and runs through the end of December, through the rest of this year, is a flat $1,200 for a series of 4, including all those products again. So it's a savings of about 18% or $257. And we always like to offer specials for those that attend our webinars, such as yourselves. So we have this special webinar offer available for anybody who wants to purchase as a result of visiting today. The 2 things we are extending are, this introductory price is a limit of 1 per person. So anybody can buy it, but they can only buy 1. The webinar offer is, we've lifted the limit, so you can buy as many as you want. And if you buy 2 or more series of 4, we will throw in 10 units of Botox for free for those of you who are Botox fans, and that's about $140 additional value. And the webinar offer is available through the end of this month. So hopefully some of you will take advantage of that. It's a very exciting offer. As we wrap it up here, I just want to state next steps and timeline. The next steps would be, I mean, if you're ready to purchase, if you're somebody who's fairly experienced with facial type treatments, and this all makes sense to you and you're pretty clear on what you want to do, you could literally just call us and we'll ask you a few pre and post treatment questions, as we always do at the time of booking, but you could just literally go ahead and book your treatments and pay over the phone and take advantage of the offer. If you're not quite there yet and you have questions or would like a consultation, that would be a great next step too. So you can contact us to schedule a complimentary consultation. We do a lot of those virtually nowadays. Everybody has switched gears to that. We do them in person or virtually, your preference. And we just want to make sure that you understand what to expect, that you're a good candidate, and really just map out a plan for you. And once you schedule your treatments and purchase your package or packages, you are off and running to vibrant, fresh skin, and just in time for the holidays if you get started soon. So that's the end of the presentation, the formal slides. I do want to go ahead and open up questions. So if anybody listening has questions and answers they'd like to, or not answers, questions they would like to submit, this would be a great time to use the Q&A button on your screen and go ahead and type in whatever questions you have. And I'm going to start going through those questions. to answer them as they come through. First question, I have melasma, can I get WiQo? As a matter of fact, yes, they're actually developing more and more protocols specifically for melasma, but the use of the PRX T33 has been shown to dramatically improve melasma to date. So it's a great treatment for melasma. And those of you who have or know what melasma is, it's not a cure for melasma, but using treatments like this can lighten the discoloration of the skin that is melasma so that you can stay ahead of it. Another question, do I need to get off my retinol before? Yes, you do. And depending on the strength of the retinol, typically we say 2 weeks before you have to get off. But if it's something you don't use every day or it's a very light concentration of retinol, we may reduce that to 1 week. But those are great questions to ask at the time of booking, and we can walk you through that. And another question, does this treatment work for acne? As a matter of fact, it does. I probably should have included a little bit more about that in the presentation. It both works to suppress oil production, so it reduces active acne from happening, and it usually suppresses it. Peels in general do this very well. It will usually suppress oil production for a period of months. So people who struggle with ongoing acne really benefit a lot from chemical peels and peels of this type, the PRX T33. The other thing it can do is lighten any scarring from acne. So little brown spots that appear as scars after an acne lesion has subsided, those lighten up really, really nicely with treatments of this type as well. So, and the last question, can I get this treatment done in preparation for a wedding? That's a great question too. It's actually a very popular treatment for pre-event skin preparation. As I showed you in the picture, it really makes the skin look amazing, like right away. So it's one of the few treatments that we would feel comfortable performing right before a special event for our patients. We get that question a lot about a lot of our treatments, and most of our treatments we shy away from for reasons of potential for downtime. So, but this is a really great pre-event prep treatment. So good question. Another question, can it be used on other areas of the body? That is also an excellent question. We actually are going to be rolling out the use of the treatment on parts of the body. That is already a thing. Providers who offer this treatment often do use it on many other areas of the body. It's great on the décolleté. It's great on stretch marks. It's great on crepey, wrinkly arm skin, like on the arms. We're super excited to get into those areas too, but we've just launched this like in the last few months, and we're just launching right now with face and neck. However, it's the same application process. We just don't have all the pricing worked out yet because we don't have the treatment times set just yet, but we're right around the corner from having all of that ready. So if you are interested in using the treatment on areas of the body, that's definitely something we could talk to you about when you come in and get your face done or when you next visit us. So we're right around the corner from launching that. We talked about including it in this presentation, but we thought we would just focus on the face and neck for now and then add the body areas later. So thank you for asking that question. So that seems to be all the questions we got today. If there are no more questions, I think we'll go ahead and wrap it up and let you all get on with your evenings. I do want to say thank you so much for joining us today and for taking time out of your evening to learn about this exciting new product. We will be sending you a follow-up email as a result of participating in our webinar, and that email will remind you how to reach out to us and also remind you of the specials that I communicated during the presentation. If you want to reach out to us, on your screen is the email address that goes to our care coordinator team, and they can help you book you a consultation or answer any questions you have, or you're always welcome to call us, and there's our phone number. So thank you so much once again. I really appreciate your time and attention, and we hope to see you at Radiance for a PRX T33 treatment soon. Thank you so much and have a great evening.